All right, we are going to bring back in AHN's Dr. Arvind Venkat as we are learning more about coronavirus every day, it seems like.
Yeah, we had to tackle a little technical problem there, but we have him on the phone for us now. And doctor, we were asking you about the new symptoms that seem to be emerging because we've heard about loss of smell, mental confusion, even lesions on people's toes.
Yeah, that's right. The CDC has listed and updated a number of symptoms that people should look out for with COVID-19. We've started to get a better sense that you could have loss of taste and smell. In addition to fever and shortness of breath, you could develop chills, which is a symptom you can get when you get a very high fever. And there are more and more reports of conditions like changes in the appearance of your toes. And now we're unfortunately also hearing about a rare syndrome in children where they can develop abdominal pain, fever, and rash that could be related to COVID-19 as well.
Yeah, I was going to ask you about that because that was something alarming that started to come out last week. We were hearing about these cases in New York of Kawasaki. So how rare is it? What are some of the things that parents should look out for?
Yeah, it is a concern, but it does appear to be a very rare consequence of the disease, and it's not 100% clear that it's completely associated with COVID-19. So scientists and physicians are diligently trying to do the work to understand this better. The symptoms that parents should look out for are fevers, especially if they last for more than a day or two, abdominal pain. If children start to have a change in their skin color, especially if they develop what's called pallor or look more pale than usual, severe abdominal pain, and changes in their urinary habits, if they produce less urine than previously, those are all symptoms that parents should look for, and red eyes as well. That also can be associated with this condition also.
Okay.
Wow, it's good to know what to look out for.
Yeah.
Now, as we open up back slowly, doctor, what should we be concerned about as we move forward in this process?
We have to recognize that all of the shutdowns that we've had are really to buy us time and to decrease the rate of transmission of disease. As we open up, unless the virus is a seasonal one, it is likely that we'll see a reemergence in transmission of the virus, and then we'll also have to see whether we'll see an increase in the number of severe cases. So at this point, when we open up, we really have to be cautious about maintaining social distancing and wearing masks in order to protect others and have them protect you against themselves in order to keep the rate of transmission low.
We have heard, doctor, about some people who have been tested and they've tested positive, but have been primarily asymptomatic. So what kind of immunity would you have after having COVID-19? I imagine there are some people who have had it and not known that they've been a carrier of it.
Yeah, Heather, there's really two separate questions there. So first, you can test positive for the virus without feeling symptoms. There is a percentage of people who don't develop symptoms or who have very mild symptoms or are in what we call the incubation phase, where they have the virus, but they haven't experienced symptoms yet. In terms of immunity, we don't have a definite answer yet. The expectation is that if you've had the virus and recovered, that you have some degree of immunity. And we're starting studies to see if the antibodies that are produced in an immune response can be a treatment for those who are severely ill, but we don't have a full answer on that at this point.
And is there any indication that warmer weather is going to help with any of this? If summer comes, will we see less cases?
We hope so, but we really don't have the data to say that yet. And there are warm parts of the world right now that are experiencing high numbers of cases. So the jury is still out on whether warm weather is going to reduce the transmission of this virus.
And while we hope that in the summer months we will see a decline, Dr. Venkat, you just mentioned about the resurgence of this virus potentially in the fall, and that's a big question about school. Should college campuses reopen? Will the kids be able to go back into the classroom?
It's a really complex question, and I know that colleges and school districts, both here in Western Pennsylvania and across the country, are really examining how to do this. There are certain countries, especially in Northern Europe, that are opening schools now, and I think we'll learn a lot of lessons on whether they are successful or not as to whether we can do the same here in the fall.
Okay. Well, if two people in the same household have COVID-19, should they separate? Do they need to be apart? And I ask this because CNN, Chris Cuomo and his wife both had it, and they said that they were told to stay apart, even within the same household, stay apart. What are your thoughts on that?
It's a tough question because if you're the only two people in your household and you have the virus, staying apart on its face doesn't make a huge amount of sense. But it's important to remember that people don't get the disease at the same time. And we don't know whether once you've had the disease, you have full immunity against getting it again. So staying apart must be prudent in order to reduce the likelihood of reinfection or transmission to anybody else who may come into the house.
And I have a two-part question here about our face coverings or masks, if we have to wash them after each use, after every time we go out and use them, and also about our clothing. That's something that I had not thought about.
On face masks, it really depends on what type of exposure you have. So my family and I, we all wear face masks when we go outside, especially into a closed building. We probably wash our masks, every few days to a week. But if we're in a close, confined area, I would recommend washing the mask that day. With clothing, it's probably less necessary to wash it every day. We in the healthcare profession are being very careful when we come home from working in the clinical environment to washing our clothes almost immediately. I think for the general public, we haven't seen that clothing is a way to transmit the virus very efficiently. So I don't know that it's necessary to wash your clothes immediately after you wear them just because you've been outside.
All right. Hey, thank you so much for joining us. Again, getting the information and hearing you explain it so succinctly and carefully, it really helps a lot. It's just good to know the answers.
It absolutely is.
All right. Well, take care,
Thanks
Doctor.
for having me.
Absolutely, anytime. And again, thanks to Dr. Arvind Venkat, an emergency room physician with Allegheny Health Network. AHN is our Eye on Health partner, along with Highmark Blue Cross Blue Shield, together for your health.